Good morning. Hi, I'm Missy Pudamont from CSG. I'm here with Dr. Shane Hollawell from Central Jersey Orthopaedics. Dr. Hollawell just gave us a great presentation on complications and causality from foot and ankle surgery. So thank you so much for coming in today. We appreciate it. Lots of positive feedback thus far already.
Great.
Just a few questions for you as a result of the presentation. I just wanted to see, for an overview for our audience, what are the typical types of foot and ankle injuries that you treat in your office, in your practice?
There's a multitude of foot and ankle injuries that you see. There's really nothing that I wouldn't be able to see or that I would say is too big of a foot and ankle injury for me to deal with, or too little of a foot and ankle injury for me to deal with. One of the more common types of injuries I would see would be sprains, strains, fractures, dislocations associated with those fractures, some sports injuries, a lot of work-related injuries, crush injuries, sometimes wounds that are developed either through a laceration or a wound that just hasn't gotten better because of some associated soft tissue injury that occurred at the same time with either bone or joint injury. So there's a lot of different injuries that I will see.
Okay. And the injuries that you do see, typically many from workman's comp injuries, motor vehicle accidents, and sports injuries, is that?
The fractures come from all different causes and all different referral sources. There's a large work comp population that I treat because we have good relationships with a lot of our carriers, and we have a good understanding of how to treat work-related injuries and timetables for recovery and maximum medical improvement. The carriers are critical to providing the right care for the patient. So if I recommend a test and there's a concern that the patient's not getting better, then often the carrier, such as CHN, will approve that test quickly. We can act on that test and provide definitive treatment. So not only do I see work-related injuries, which is a large part of my practice, but I also see sports-related injuries, see recreational athletes, see more competitive athletes, see someone who may have been involved in a motor vehicle accident, see patients that have had polytrauma as a result of one isolated injury. And we'll see some routine fractures. A patient may twist their foot or ankle just walking off a uneven surface or slipping on a wet surface. And so there's all sorts of pathology that will come to the office that require some type of evaluation and some treatment that goes with that evaluation. What
types of pre-existing conditions can cause complications in the healing process?
Some of the more common pre-existing conditions would be diabetes, of course. Someone who has been diabetic for a number of years often presents with some vascular concerns, meaning they might have some peripheral vascular disease, they have some neuropathy issues, meaning they don't have the same protective sensation. They're the two primary things you see in the lower extremity that may pose problems for timeliness of healing. Patients that have arthritis, whether it's a pre-existing osteoarthritis or whether it's a systemic arthritis, such as rheumatoid arthritis, typically have a negative impact on their overall recovery. They can be managed tightly and you can optimize the way they recover, but they often will pose additional challenges for someone who doesn't have any other comorbidities. Someone who's a large body mass index may pose some issues in terms of timeliness to get back on their foot or the lower extremity if they're dealing with a fracture or a substantial injury. So there's some issues that we see in my patient population, or some type of comorbidities we see in my patient population.
How about non-compliance? Does that become an issue?
Patients' non-compliance always can affect outcome, particularly in the lower extremity. If you're suggesting or informing them that they need to be non-weight bearing, that can certainly compromise their recovery, whether it's an injury that required surgery or whether it's an injury that requires non-weight bearing for a period of time. So if they're non-compliant from a weight bearing standpoint, it can impact recovery rather significantly. If there's a smoker, encourage them or instruct them not to smoke. They can sometimes have delayed healings in their tissue or even their bone. So the compliance with tobacco users is sometimes difficult because they've been smoking for a long time, so you have to figure out means to have them discontinue tobacco use. So they're two of the primary issues that you would see with non-compliance: early weight bearing or premature weight bearing against your advice, or someone who's a tobacco user and continues to use in spite of your recommendations to stop.
Finally, what are some of the complications that can occur down the line post-surgery, post-MMI that may be anticipated actually?
So if a patient has a high energy injury, which we would call probably a fracture dislocation, or they have some soft tissue injury associated with ligament tears or cartilage injuries, you can often expect post-traumatic arthritis to develop. And that may happen, 2 years after the injury, may happen 5 or 10 years after the injury. Everybody's heals at a different timetable, of course, and some patients may have post-traumatic arthritis that develops and have no issues. Some patients that may have a little post-traumatic arthritis that develops and may have a lot of issues. So you need to treat those patients specific to their complaints, and you need to understand at the time of their initial injury they may or likely to develop post-traumatic arthritis just because of the extent of their injury from the first time it happens.
Right.
And other issues that may come into play, not necessarily in a long term after MMI, but potentially in a shorter term scenario, is wound care issues. If they're a smoker again, if they have a lot of injury to the soft tissue, they may have problems healing their wound or their incisions if you need to do surgery in a timely fashion.
Okay, well, thank you so much for your time today. It's been very helpful.
My pleasure. Thank you
Take
for
care.
having me.
Thank you.